Hi all, welcome to today's session. Today we're going to discuss about the screening and vaccination protocols across the age groups. We'll see how we'll be dealing with the national and global recommendation, how to apply them in the family practice. So, first we'll move on to the importance of screening and vaccination. Screening and vaccinations are like a cornerstone of preventive measures. Screening detects the disease earlier than the symptoms and allowing the treatment that reduces the morbidity and mortality. Vaccination prevents the infectious diseases, hospitalizations, and long term complications. So, together, these both will reduce the individual suffering and population burden, especially important in the family practice. And in practice, this means every visit is a chance to screen and check the immunization status. So, in clinically, what we have to look for is the presentation. The presentation will be often a symptomatic condition like hypertension, early diabetes, cervical precancer. The key investigations you can do is BP measurement, fasting glucose, HbA1c, lipid profile, pap smear, HPV test where indicated. And in OPD, you can do the opportunity screening at every visit, update the vaccination record, and IPD, you can review the catch up and missed if I have vaccines before discharge when safe. For example, tetanus after injury and all. So that is about the importance of screening and vaccination. Now comes to the general screening principles. So general screening principles should be applied on an age based and a risk based approach. Use an evidence based tools and national programs where available. So screening should balance the benefits, harms, cost, and only use the test with proven value. And opportunity screening in OPD is very high yield, but you can measure the BP, BMI, and ask about the smoking, alcohol, and family history. So use the national guidelines or national programs. For example, cancer screening programs for or NPCDCS type for non-communicable disease too. So such things, if you follow a national guidance, we can prioritize the resources and follow the recommended intervals. So clinically, you can do these general screening things. Most of the time you can do in OPD itself. In IPD, you can do the start investigation for any acute presentation and ensure the outpatient follow-up for the screening, better screening results. So that is the general screening principles. Now first we'll discuss about the pediatric screening, that is from the 0 to 18 years. For children, we prioritize growth, development, and immunization. So growth monitoring is the weight or height, BMI for age at every for all the ages at every visit. Screen the vision and hearing early for newborn infant checks and school entry students, like kids, and monitor the developmental milestones like social, motor, and language, and screen for anemia in high risk areas or symptomatic kids, and dental checkups and oral hygiene counseling should start early. So crucially, you should follow the national childhood immunization schedule strictly and ensure on time vaccination is given. So in OPD, how you can do is growth charting, milestone screening, administer the routine vaccines, and catch up the schedules. In IPD, in cases of severe malnutrition, complex infections, or immunization reaction management, ensure the catch up plan on the discharge. So that is about the pediatric screening. Next comes the adolescent screening. So adolescent screening is from 10 to 19 years. So adolescent needs a targeted screening like BMI and nutrition, including the eating disorder vigilance, anemia screening, especially in the girls. Then mental health screening like PHQ-9, GAD-7, or simple questions about the mood and risk. And sexual health counseling also is very important. And HPV vaccination is major preventive tool to also follow the national age recommendations accordingly. And this also in adolescent screening, this is also an opportunity to teach safe sex contraception and counseling and address the vaccination gaps. So that is important here. So in OPD, most of the times you have to do a confidential counseling, HPV vaccination administration, and brief mental health interventions and plan the follow up. In IPD, when it comes to IPD, severe self harm, acute intoxication, or severe infection. In such cases, you have to stabilize the patient and link to the adolescent services. So that's about the adolescent screening. Next comes the adult screening, that is from 20 to 39 years. In young adults, screen for BMI, BP, waist circumference, HbA1c, lipid profile, if it is risk based, and mental health screening, and substance use assessment. And vaccinations should also to be considered, like TDAP, influenza, TDAP booster in adulthood, hepatitis B if not previously vaccinated, and influenza for specific risk group. And also you have to focus on the counseling on lifestyle modification like diet, exercise, tobacco cessation. Use this period to prevent the development of chronic diseases later in the life. So this what are things you will be doing for the adult screening. Next comes the woman specific screening. So woman specific screening during the reproductive and middle age. Women require specific screening like for cervical cancer screening, pap smear or HPV testing as per the national intervals, breast screening by clinical examination and mammography as age appropriate. Then anemia screening, especially in the reproductive years, and pre-conception counseling also is very important. Then rubella immunity check and vaccination for women of childbearing age if non-immune per the national policy. Then TDAP in pregnancy as recommended to protect the newborns, and always link the screening results to referral pathways for any kind of abnormal findings. So rubella also if needed you can give. And in OPD, how you'll deal with women specific screening is like you have to perform or arrange the screening test and vaccination counseling. In IPD, urgent evaluation for suspected invasive cancer presentations or obstetric complications and all. So ensure the follow up plan. This is about the women specific thing. And next is the elderly screening. Elderly screening in older adults focus on the BP, glucose, control, lipid management, vision and hearing assessment, and fall risk assessment and cognitive screening, MMSE or MOCA where available. Then vaccinations are very critical. Annual influenza vaccine, pneumococcal vaccines as per the national recommendations, and zoster vaccine where available. Assess the patient, assess the polypharmacy and functional status to tailor any kind of screening and avoid over testing in the frail patient also. So in OPD, medication review, vaccination updates, and arrange the community support for elderly screening. In IPD, you can do is manage the acute complications like falls, fractures, severe infection, and all, and ensure the vaccinations are done everything accordingly. So this is how you will be doing the elder screening. Next comes the vaccination schedule, a general overview. So follow the national childhood schedule strictly. Give HPV in adolescents as recommended. Adults need TDAP boosters, hepatitis B if at risk, and influenza for at risk groups. Elderly should have should receive the influenza and pneumococcal vaccines. In OPD, we update the immunization records, give the vaccines, and counsel on indications and side effects. In IPD, what we will do, we must check the immunization status during the admission of the patient, provide the indicated vaccines before discharge when clinically safe, and always document the consents and the adverse, all the event counseling things you have to document it. So that's about the general overview of the vaccination schedule. Now comes the OPD versus IPD protocol approach, how you will be doing. OPD, as you know, you have to do the routine screening, counseling, and vaccination. Schedule the follow ups and monitor the patient. Use every contact as an opportunity. In IPD, you have to manage the acute infections and requiring urgent vaccination review, and provide the mixed vaccination. And also, you have to be catch up, do proper catch up for planning. The follow up plan should be done before the discharge of the patient. So that is how you will be doing the OPD with IPD protocol approach. So to summarize the today's session, so today we discuss about the screening and vaccination. So screening and vaccination across the lifespan prevents the disease and reduce any kind of complication. So use an age and risk based approach. So childhood, pediatric, adolescents, elderly, and adult, etc. And the next is follow the national guidelines and protocols. Take every OPD visit of the patient as a chance to screen and check the vaccines are done properly. For abnormal screening results, know your pathways, like for vaccine gaps, plan the schedules and document the records. And in IPD, stabilize the acute problems and use the discharge as a prevention opportunity with vaccinations and screening referrals. So, one practical action you can do is in the OPD versus IPD, you have to prevent the diseases, and you have to make sure proper screening and vaccination is done for every individual. Whichever patient comes to your OPD, when you take the history, make sure you ask everything. If you know about the vaccines for pediatric, adolescents, elderly, you will be knowing how to take it and how to ask the patient regarding the vaccines and thing. So you should be able to differentiate it, and you should have the knowledge of different vaccines also. What are the important vaccines should be given or should be taken by the patient in the different stages of their life. So that's it for the today's session. Thank you so much and have a nice day.